Good afternoon, Dr. Natoli at Functional Spine and Sport.
Dr. Schultz.
We are Illinois' only adhesion specialty clinic. So we specialize in finding and fixing fibrous muscle adhesions and nerve entrapments and fix them conservatively. And just yesterday we posted an exciting announcement. Dr. Schultz is now our resident low back, hip, and sciatic specialist. And we are the Midwest's first clinic to do this conservatively. So just to kind of follow the specialty of what orthopedics are doing and how successful they are when people need surgery, to do it in a specialty format. We're also now doing that in a conservative format.
Yeah, it's very exciting. This came on the heels of 2 very intense years training with Dr. Natoli and Dr. Brady of Integrative Diagnosis and going over really tough cases and how to manage them and how to get them as best as they possibly can. Low back pain is a huge deal. It's literally the leading cause of disability worldwide and costs our healthcare system about $1 billion.
Yeah.
Or sorry, not $1 billion, $100 billion a year.
Yeah.
So there's huge need for this, and people need to know that there are great options out there to get out of low back pain and live a better life. And that's what I'm dedicating my practice to, is helping as many people as I possibly can. So I couldn't be more excited, and I'm just happy to get out there and start helping everyone that needs my help.
Yeah, great. And mostly who we see are people that have had pain for longer than 6 months and have already been failed by 3 or more providers, or they just didn't quite get the care they needed and didn't quite get the results they need. If you don't live in Illinois or you don't live close to us and it's not feasible to fly and see us, go to integrativediagnosis.com and find a provider that's certified in what we do and get the best care you can possibly get. So let's get into questions today. First one, what causes muscles to stick together?
Great question.
Yeah.
So, it's Dr. Natoli already alluded to it, but it's adhesion. The technical term for this is fibrosis or fibrous adhesion. This stuff lays down in your muscles, and it sticks muscles together, doesn't let them stretch and contract properly, and leads to a lot of pain and tightness and just decreased flexibility in general.
Yeah, it traps nerves. It's just bad news all around.
Mm-hmm.
Another term that people throw around, synonymous with this, is scar tissue. However, it's technically not the same thing medically speaking from a diagnostic standpoint. So you might also hear that, but we're not thrilled about using that term because it's technically different. So it's like calling something blue that may not be blue. It may be royal blue or navy blue or
Purple.
yeah. Yeah. So those details matter. So next question was, what are knots in muscles? And that can be a couple different things. One of the major things it can be is the fibrous adhesion that we talked about. The other thing it can be that you've probably heard of,
Trigger points.
Yep.
Or it can be a buildup of inflammation in the muscles, and it feels like a knot because the muscles are just literally swollen up and just irritated and inflamed.
Yep.
So it's really important that you find a doctor who can distinguish these 3 out, because if you're treating something that can be treated with ice instead of treating the actual cause of the problem, the results are going to be haphazard. So you really need to find someone who specializes and can distinguish each of these layers out, so you get the right treatment and you can feel better faster.
Yeah. So knots is kind of a non-specific term, like pain. Like, well, it hurts. Okay, where, what kind? All those details matter. The same thing here. So these are the most common things that will make you have knots, like in this spot or some of these other spots that people get.
Yeah. And then next question is, do muscle knots go away?
That depends.
It depends on what you're treating.
It depends on what is causing the knot, first of all. So these 2 will go away. This one will go away on its own if you just stop beating it up. This one will go away if you fix dysfunction that's causing the muscle to continue to get trigger points. This one won't go away unless you find somebody certified like us or have had this training that knows how to fix the fibrous adhesions. Most of the time, this is the type that doesn't go away with treatment, because people are hammering away at this or hammering away at this or hammering away at this with the wrong technique or the wrong tool, and it just doesn't go away. So yes, they can go away, but it goes back to, it's important to figure out, identify exactly what it is, so you know exactly what treatment works for each condition.
Yeah, you gotta figure out the cause before you can start the treatment.
Yeah. Anything else to add there?
No?
Okay.
Next question is, are muscle adhesion and fascia the same thing? Short answer to that is no, but the technical answer is they're similar, that they're both made up of the same tissue. They're both made up of collagen. Fascia kind of helps keep the muscle supported and keeps the overall structural integrity of the muscle there, and it should be there. What adhesion is a buildup of those collagen fibers, and it sticks the muscles together, and that should not be in the muscles at all.
So shortened version of that: structural support, integrity, good. Sticky, disorganized, sticks things together, bad. All right, but they're both made of collagen, so it's thrown around like they're the same thing. We're treating fascia as somehow productive, but it's like treating healthy muscle. If it's treating healthy fascia, it's not really that productive. You want to treat the pathology that's causing the dysfunction rather than just trying to treat structures or treat muscles or treat fascia in general. Cool.
Last question is two-parter, so we're going to kind of pick this apart and dive into a little bit of details with this one. It's adjustments made me worse, and then should I go back? So that's the first part of the question. So when you're going through any treatment process, the treatment is designed, if it's doing what it's supposed to, it's designed to get you better within a short amount of time, and there's reasons for that. So if any sort of treatment's getting you worse, not just conservative care, it's the wrong treatment or the diagnosis was wrong. Anything to add?
Yeah, or if you're just not improving. I don't know if you said that.
No, but
so you want to have sustained progress too, not just that it made you worse. I mean, that's obviously bad and you should not go back. But if it's not improving after, generally we say we give something 4 weeks is kind of our standard. And if it's not sustainably improving in 4 weeks, it's something was missed important.
Then the second part to that question is, if I do go back, is something out that needs to be put back in place? This is an old school mentality that's been thrown around in the traditional, manipulative circle for hundreds of years. We didn't know as much about the body back then as we do now, so just that mindset in general is just nothing. It just doesn't go out. Something doesn't go out on its own. There's always a reason for it. There's always a why for it, and you really have to dig down to figure out why that feels like something's gone out in the first place.
Yeah, and the feeling that something went out actually isn't something going out. And I think most people intuitively know that, but it's been thrown around so often that that's what people still call it. So, just like surgeons in the past didn't wash their hands before surgery, and a bunch of people got sick and died, and then they figured out they need to clean their instruments and clean their hands and wear gloves and sanitize everything. Surgery's got a lot better and people stopped dying. So this is just one of those, it's not at that severe of a case, but it's just one of those outdated things that hopefully soon it will just be forgotten. But it's traditionally taught in schools still in the chiropractic setting, so that's why it's still being used.
Yeah, it's more the out feeling is a protective mechanism that something underlying has been damaged or inflamed and irritated, and your body's shifting off of that to unload it.
Cool. All right, guys. Thanks for watching.
Thanks for watching.
We'll see you soon.